it is already very late and the time allotted is also short, but I would try to do the full justice to the topic which has been chosen by me, that the non-pharmacological interventions in the era of PDE5 inhibitors. Maybe that many of you would be thinking that in this particular topic, I would be covering about the Master Johnson's techniques or something stops starts technique, like that thing. But those are not exactly the focus, because this study is, this particular presentation is totally experience based. I have not reviewed the literature so much, only a part, only a slight review of the literature has been made, but most of it has been prepared on the basis of what we are experiencing here in our OPDs or in our day-to-day practice. What do PDE5 do? I think it has been widely covered and I don't need to repeat again and again. In brief, I can say that it releases nitric oxide, and which leads to dilatation, and it can help us in the having a good intercourse. But is this enough? The question is what it cannot do. Whether it is vagina, whether it is clitoris, or whether it is penis, these are not the site for where we can enjoy or we can have the pleasure out of the sex, because the organ of pleasure and organ of sex, these two are different. Sex is always enjoyed by the brain, but it is done by hands, it is done by penis and other things. Those are the simply the external modes, but it is the pleasure is felt at the sex. And can this PDE5 can take care of the social problems which are often associated with the patients who are taking consultation, especially for the purpose of sexual disorders. When the patients with the sexual disorders are coming, they are having several myths about their sexual knowledge. Marital discord are very common, and interpersonal partner violence and divorce are there. Ifs are also there. But if all these problems are there, would PDE5 inhibitors would be working well? I think the sex may be there, but it would be just like a rape. I think neither man would be enjoying nor woman would be enjoying, and it would be just a forced activity under the PDE5 inhibitors. And in fact, under these kinds of circumstances, instead of improving the situations, it can even worsen the situation. So what I mean to say is, we also, whenever we are prescribing PDE5 inhibitors, we need to take care of the other social aspects also. And I'm thankful to the other participants that they have covered the biological aspects well, and these topics need to be covered yet in the detail. What myths they have? They have myths about the dhatu. This is leading to the decrease in their sexual energy. It's leading to the decrease in the physical performance. They are having small or the thin penis. Virginity is very important for having sex, especially for the first time after marriage. And the sexual time, this should be about half an hour or hour, like that. The people are having these kinds of fantasies, because of which they are often misusing the PDE5 inhibitor, as one of the earlier presenter has also presented to us. So these also need to be taken care simultaneously when the patient is coming to us. Marital discords nowadays are becoming more problem, and where are the more marriage? Of course, this is still a universal phenomenon in our country. The divorce rates are less, but the marital discords and the poor mutual relationships, these are going up and up, and marital discords are not uncommon nowadays. Whenever the patients are coming to the psychiatry outdoor and we take psychosocial history, and we come to know that if there is one or the other reason in the family because of which the husband and wife, they are not behaving well with each other, leave aside the sexual side. Sexual side contributes only to the 10 to 20% of their life, and the rest of the part is covered by the different other kinds of the social intercourse. They share bed, or they get sexual only once or twice in a week, but other kinds of activities they have to perform almost daily. Relationship problems in in-laws, that is also very frequent in the patients who are taking who come for the sexual consultation for the sexual disorder. Many times women have reported, although they present in a very small number in the psychosexual clinic, but whenever they are presenting even for the other problems, they often report that they are not having a healthy relationships with their mother-in-law especially, and because of that their relationship with the husband is also not very comfortable. They often report that what to do about the sex when the husband is not loving. So intimacy and the sex, this is completely different thing for them. And they also feel both times it happens, whether it is for the men or whether it is for the women, that they feel that one or the other person is either suppressed or one is dominant in the general relationships also, and at the time of having sex also. And it is also said that there is always an expectations, especially in the rural communities, that they should perform the role and they should behave as per the gender roles expected by the community. But nowadays we see that our community is advancing and there are a lot of socioeconomic changes are taking place. Women are also working, and so the gender stereotype needs to be neutralized. But with these kinds of culturally based beliefs, the things do not come to the surface very easily unless they are specifically explored. And without exploring these, any kind of treatment with the for the sexual dysfunction is likely to be incomplete. Interpartner violence, 30 to 50% of married women in India, they complain, and number may be even more, because the slight violence or the emotional kind of violence is many times not reported, and many times the violence is justified also. Yes, they often say that we are not well educated, husband is well educated, so in case he's telling something, then it means that we must have done something wrong, that's why the problems are there. And in these kinds of situations, how can we have sex, and how can we think about sex at all? And male victims of the interpartner violence, now these things is something new, or it was existing and we didn't care for this thing is also coming. But ultimately we come to the situation that whenever the sexual disorder is there, these kinds of context, social context is always there, and it is missed. Who is the actual victim? Victim is the patient who is presenting to us, or it is his partner. Most of the times it is the couple who is the victim of this kind of situation, and it is leading to the sexual disorders. And sexual disorder in this context is not the problem of one individual, but it is the problem of the dyad, which need to be managed in the context of the social circumstances they are living in. Divorce rates are low in India. It is quite surprising that we are having more number of violence, we are having more victimization, we are having more problems in marriage, and so the low divorce rate. Does it make any kind of sense? Is it mean that we are living happily in our life? And these kinds of things also need to be taken care of in our country. In the northeast region, especially in the tribal regions where there are the matrilineal families, there the divorce rate is really high, and much high in comparison with the rest of the Indian continent. But are people living very healthy and their sexual life is very satisfactory over there? No, studies do not exist, and we need to work upon this also. So sexual disorder caused by, I'm coming to the end of my presentation, the sexual disorder caused by individual or the relationship problem. When the therapy resolves the underlying issues, the sex will automatically improve. But improving sexual performance won't do the reverse way. It won't improve the social situation. That may happen, but in the rare situations only. And if we want to have the best aphrodisiacs in these kinds of conditions, it has to be love, it has to be an open, direct communication, and it has to be the caring attitude for each one of the partner, and it has to be mutual. And we have to have the healthy sexual styles also, whether it is a traditional, complementary, or best friend. And many times, although the not preferred one, but many times the emotionally expressive sexual style may also be the one of the alternatives available for that. With the advances in the biomedical field, standalone medical interventions will resolve the most of the problems, but would they resolve, and would they will the partners be enjoying sex because of their physical problems are resolved? That question remains even in the era of PD5 inhibitors. And our strategy should be to deal with the sex indirectly. That means that the social context where the person is living, that need to be evaluated properly, and we need to be very sensitive to it. Whenever a person is coming to us with a sexual disorder, we need to ask how the relations otherwise are with the patient's spouse and with the other family members who are living with them. Once the couple has created the healthy sexual relationships or psychological interventions, they can proceed to help themselves, and I think we won't be needed anymore for them, and they will be living happy, and we also will be living very happily, taking care of the other patients. With this, I come to the end of my presentation. I thank you very much.